So today we'll be talking about anorexia and bulimia with
Dr. Park
and Dr. Tran. So, what exactly is anorexia nervosa?
Anorexia is an eating disorder that makes people lose more weight than is considered healthy because of the fear of gaining weight. Okay, then what's bulimia?
It's an illness in which a person binges on food or has regular episodes of overeating and then uses different methods such as vomiting or abusing laxatives. So the symptoms for both anorexia and bulimia are
Extreme weight loss, thin appearance, abnormal blood counts, fatigue or dizziness, thinning of hair or fallouts, absence of menstruation, irregular heart rhythms, low blood pressure, dehydration, osteoporosis, which is the thinning of bones,
hint, hint, you might want to remember that,
refusal to eat, afraid of gaining weight, lying about amounts of food eaten, and depression.
And symptoms strictly for bulimia are broken blood vessels in the eye from the strain of vomiting, dry mouth, rashes and pimples, and small cuts and calluses across the tops of the finger joints. So, what are the causes of anorexia and bulimia?
The exact cause of anorexia nervosa or bulimia is unknown,
though genetics, psychological, trauma, family, society, or cultural factors may play a role.
As mentioned earlier, one of the things that may contribute to anorexia or bulimia are biological factors.
There may be genetic changes that make some people more vulnerable to developing anorexia. It may be that some people have a genetic tendency toward perfectionism, sensitivity, and perseverance.
There also may be psychological reasons.
Young women may have OCD personality traits that make it easier to stick to strict diets and forgo food despite being hungry. There's also evidence that serotonin, one of the brain chemicals involved in depression, may play a role in anorexia. Lastly, another factor may be due to their environment.
Modern Western culture emphasizes thinness. Peer pressure may help fuel the desire to be thin.
So who is most likely affected?
Females.
1 out of 200 women are diagnosed with anorexia and bulimia.
Age.
Late teens or early in their adulthood.
Biology.
People who have siblings or parents with an eating disorder.
Psychological.
And emotional issues.
Actors, dancers, and models.
Who have societal pressures.
And athletes.
Who have performance pressures in sports. There are ways to prevent anorexia and bulimia from happening.
You can assure people about their positive body image, teach others to eat and exercise for a healthy and not for a perfect body, don't encourage dieting to young kids, reduce peer and family weight-related criticisms, encourage exercise, and have a healthy view on yourself. If diagnosed with anorexia or bulimia, there are treatment available.
For anorexia, there is psychological help, hospital admission for severe cases, medication for depression or OCD. An estimated 4 out of 10 people with anorexia will make a full recovery, yet only 1 of 10 will enter into treatment. For bulimia, there's counseling, antidepressant medications. Anyone can fully recover no matter how long they've suffered from bulimia.
So the effects of anorexia includes
extreme thinness, 10 to 15% will die due to complications. Ages 15 to 24 are 12 times more likely to die due to cardiac arrest or electrolyte imbalances, kidney failure and or infections. 50% will suffer from osteoporosis, which is bone thinning. Growth may be slowed in younger people. Weight gain due to slow metabolism, stomach shrinkage, and delayed of puberty. So the effects of bulimia include
oral complications due to vomit acid, which includes eroded teeth enamel, dental cavities, and sensitivity to hot and cold. Swelling and soreness of salivary glands, which is also known as the parotid glands.
Ulcers, ruptures, and strictures of the esophagus. Amenorrhea, which is the absence of a period. Loss of normal colon function. Electrolyte imbalance. And if if you're pregnant, can affect the fetus. Quick check number 1. 1 out of how many women suffer from anorexia nervosa?
The answer is 1 out of 200 women suffer from anorexia. Quick check number 2. True or false? It is estimated that 5 out of 10 with anorexia will make a full recovery, but only 2 out of 10 will enter treatment.
The answer is false. Only 4 out of 10 will make a full recovery, but 1 of 10 will enter treatment. Quick check number 3. What is osteoporosis?
The answer is the thinning of bones. Quick check number 4. What is the exact cause of anorexia and bulimia?
The answer is, there is no exact cause to anorexia and bulimia, yet genetics, psychological, and society may play a role.